This is the horizontal plate of the palatine bone, and just think of it, it's on the horizon, right? So that's the flat part of the palatine bone. And then you have a perpendicular plate of the palatine bone. So you have horizontal and then a perpendicular. Okay? So here's your horizontal plate, if you look at this picture, and that's a mid-sagittal view, right? And here's anterior over here for this picture. Okay, anterior. And there's the perpendicular plate. So it helps form the posterior aspect of that nasal septum, the palatine bone. All right, so here's a nice little link you guys can go to help learn about your nasal conchae a little bit more. So it's on that first slide I gave you too if you want to get to them quickly. But here's your nasal conchae. Here's your inferior nasal conchae, which is a component. In your book it says it articulates, and then other texts say that it's actually a component of the inferior nasal conchae. So I'm going to categorize it with the maxilla, okay? All right. And then you'll see that we have a middle and a superior nasal conchae as well. And we'll get to those in just a little bit when we start talking about this bone, which is the ethmoid bone. And this whole bone here in pink. Okay, and like I said, it humidifies and warms the air. And if you don't have air traveling through your nasal cavity, your oral cavity, and your pharynx before it gets to your respiratory tract, it can be really hard on your lungs. So if you've ever seen or worked with a patient that has a trach, they usually have quite a bit of mucus that you have to suction out. And that's because the air doesn't pass through those passageways that help clean, warm, and humidify it. So it's really hard on the lungs. And in order for the lungs to protect themselves, they create more mucus, and because that air is so harsh. So anyway, they're important is kind of the point that it's at. All right, so the next bone we get to meet is the vomer. And you'll see here, this is a picture of the cranial skull model. It kind of forms the anterior triangle, anterior-inferior aspect of the nasal septum. So if you look here on this picture to your guys' right, the vomer is this little gray guy, okay? And you'll see how it's kind of got a little point at the end, and you're only seeing the little point here, okay? Because this part up here is the ethmoid bone, but this broader part is the vomer, okay? So here's the ethmoid up here, and then here's the vomer. Okay, so just think of it, see the triangle? So this would be the anterior here. So this is a lateral view, right? And this is posterior if you dissected your way from the skull. So if you're gonna put the posterior aspect right here. And then you flip this around and put the anterior there, right? Do you guys see that? Okay. All right. So the next one is the zygomatic bone. You think of that as your cheekbone. The zygomatic. Okay, and there's several processes, and this is when you kind of get, tricked a little bit. But this is the frontal process, okay? Because it articulates with the frontal bone, which is this one. Remember, that's a cranial bone, not a facial bone. Okay? All right, this is the temporal bone. And even this blue part is part of the temporal bone, okay? So this is the temporal process right here of the zygomatic because it articulates with the temporal bone right here, okay? Right, the next one is our maxillary process. So this is your maxilla here, and we went over that one, right? And then you have your orbital surface, which is right here, and that helps form the orbit of your eye, okay? Right, next is the lacrimal bone. It's a tiny little bone. It's actually where your tears comes out of your lacrimal duct. Okay, so here it is. It's just lateral to the nasal bone. So the nasal and that frontal process of the zygomatic. Right, and then here's your hyoid. This is an anterior view of just the skeleton of the hyolaryngeal complex. So here it is in all its glory. You have the body of the hyoid, which is right here. Then you have the lesser cornua or lesser horn and the greater horn. The greater horn just looks like a UG, isn't it beautiful? The greater horn looks like a continuation of the corpus or the body, but it's not. It's called the greater horn. Okay? So the corpus will be here, and then the greater horns this way, and the lesser horns go up this way. All right, now we get to talk about the cranial skeleton. And the first one is our frontal bone. That's your forehead here. And then we have our zygomatic process, okay? Because remember, this is our zygomatic bone, our cheekbone. Okay? Here's our frontal bone. And that's why having a skull is kind of nice, because you can even take dry erase marker to it. It's really awesome. But it's up to you guys. And supraorbital margin here, so that helps form the orbit of your eye. On this side, okay? So here again, here's your zygomatic process. All right, remember, it is a cranial bone. All right, the next one we're going to talk about is the ethmoid, and it's a very three-dimensional bone that's kind of hard to wrap your mind around. So go to this expert, anatomyexpert.com, and it's kind of nice. It gives you a good preview of it. But I'm going to walk you through the ethmoid. Let's go ahead and start with this view here, this anterior view. Okay. All right, so this whole portion of the bone, so anything that I just circled right here, is all a part of the cranial cavity. Okay, so this bottom part is the cribriform plate. It's actually where your olfactory bulbs sit. It's cranial nerve 1, and they sit right in there. And then if you look at a cranial skull from the superior view, and I'll show you a picture, you'll see little bumps or little holes. They're called olfactory foramina. And they're little passageways for nerves to travel through, so that when you smell things, the nerves can travel up through your nasal cavity to your cranial cavity and innervate that cranial nerve 1, the olfactory bulb. Olfactory means to smell. And I think of old factory, they're old and smelly. That's how I remember that. So they innervate or they kind of connect with, that's what I mean by innervate, that those nerves touch another nerve and send information about what you're smelling. So anyway, that's an important part. And then the cristagalli looks like a sail, okay? And I'm sure there's some reference to whatever that root is, cristagalli. And it sits between the olfactory bulbs. So here's the cristagalli, and then we have the cribriform. So basically the olfactory bulbs sit here on that cribriform plate, okay? So that's the anterior view. And you'll see that if you follow the cristagalli all the way down, okay, this basically helps form that, your nasal septum, kind of the posterior, and then, well, anterior, most of the anterior nasal septum, okay, is right here. It just kind of carries down. That's the perpendicular plate of the ethmoid bone. And then all of this stuff right here, well, this helps form part of the orbit of your eye. And then this stuff here is these are your nasal conchae. You have your middle nasal conchae and then your superior nasal conchae on each side, bilaterally, right? So this is an anterior view if we dissected it away from the rest of the skull. Okay? And I'm going to show you another picture from the superior view and you'll get a better picture. But just imagine this really helps form a big part of your nasal cavity. Okay? And then this part up here travels up through to help form the cranial cavity, which makes it, even though the majority of that bone is part of the base, just a little bit of it helps form the cranial cavity, so it's a cranial bone. Okay, so here's a lateral view. Here's the orbital plate, so that helps form the orbit of the eye. Here's the cristagalli, okay? And then here's the perpendicular plate of the ethmoid bone. Here's a superior view, so here's the cristagalli. There's those olfactory foramina, you can see those little dots. Okay, good. All right, so here is the perpendicular plate of the ethmoid bone. Remember the vomer was down here. Well, not quite that far down, but you got it. All right, okay, so I just want to show you the difference between the vomer and the ethmoid. So the vomer's here circled in green, and then the perpendicular plate of the ethmoid is here, it's circled in yellow. Okay. All right. So we're going to talk about the sphenoid. Oh, let me show you. This in this kind of maroon color here, that's the ethmoid bone. That's the only little piece that it can help comprise the cranial cavity. Well, now we call it cranial bone. Okay, so that's the cribriform plate and then the cribricolli shooting out. The rest of it is in the nasal cavity. Okay, and the next bone I'm going to talk about is a really pretty bone. Kind of looks like a butterfly to me, so I'm just circling it for you. It's in this pink. Okay, called the sphenoid, and I used to get sphenoid and ethmoid mixed up. So I just remember that ethmoid is earlier in the alphabet. Ethmoid, and then this is my sphenoid here. Okay. All right. So there are several things that I want to point out to you guys. First, the sella turcica, which is right here. And if you look at it in a three-dimensional view, it looks like a saddle. It's actually called the Turkish saddle, and a gland called the pituitary gland is it. And then we have our greater and our lesser wings. Okay. So I'm going to show you another picture of the greater and lesser wings. That's a little bit better. But here's a superior view of the sphenoid being dissected away from the cranial skull. So it's the same view we're looking at. Here's the sella turcica. And then, so there's the lesser wings, and then the rest of it is the greater wings. So here's the lesser wings in blue, and the rest of it's the greater wings, all of this stuff out here. Okay. These are your pterygoids. This is your medial pterygoid. This is your lateral pterygoid. Okay, let me go back really quick. So this is superior, up here, superior. This is inferior down here, just so you guys get oriented, okay? This is a superior view, so here's the sella turcica again, Turkish saddle. Here's your wings, your lesser wings, okay? And then your greater wings. Okay. All right, so there's a picture of your greater wings. All right, so now we're going to move on, and I just want to show you the lateral view of the sphenoid bone. So here is a picture of it. So it helps form a big part of that lateral aspect of the cranial skull. Okay. All right, and it actually continues on down this way. So this is the medial pterygoid, and they're in lateral pterygoids, these are the pterygoids, but they'll make more sense later when you learn about muscles. So there's the orbital plate, so it helps form the posterior aspect of the orbit of the eye. Your lateral pterygoids and your medial pterygoids, and their muscle attachments to help manipulate the jaw in a number of different ways. All right, so then we have the optic canal. It's just on the anterior lateral aspect of the sella turcica. Okay, and then you have the superior orbital fissure right here. Okay. And it's a hole that goes into the orbit of the eye. Same thing with this one. Optic canal is where your optic nerve travels through. Okay. And then you have your foramen rotundum here, ovale and spinosum. So I think that my friend Ross sits in the sella turcica and he's riding that butterfly. Remember how it looks like a butterfly, and then the medial and lateral pterygoids are like the legs of the butterfly? So my friend Ross sits in the saddle, so it's foramen rotundum, foramen ovale, and then foramen spinosum. All right, so now we're moving on to the temporal bone. So the temporal bone is right here, right by your ear. Okay? And it's dissected away from the cranial skull there. So here is my skull, and I've outlined the temporal bone. Okay? So this is anterior here. Okay, so we have the zygomatic process of the temporal bone. So you guys can put this together, but the zygomatic process articulates with the zygomatic bone, right? Okay, so we have the mandibular fossa, and the condylar process of the mandible. Remember that bone? It's one of the first ones we learned. The condylar process of the mandible sits right in there. Okay, we have the external auditory meatus, and it's really the passageway to the inner ear. Okay. So there's external, and then you'll have the internal auditory meatus, and we'll look at that in just a minute. Here it is, actually. So this is an internal view of that same bone. We just basically took that bone here and flipped it this way. Okay? Now, there are several different portions to the bone, 3 actually with the temporal bone. We have the squamous portion, so I'm not sure if you guys went over the squamous epithelial tissue, but I think of squamous as squished. It's flat, like a fried egg flat. Okay, squamous squished, and that's this part up here. Okay, so this is squamous. This is the squamous portion of the temporal bone. Okay, so here you'll see it on the internal view. Okay, and this is the petrous portion. And then the mastoid portion. And here's the mastoid portion here. And I have the mastoid process, so here it is. Mastoid portion, petrous portion. Okay, so 3 different portions. And we're going to look at the jugular foramen. It's actually formed by 2 bones coming together, the temporal bone and the occipital bone. Okay, so here is a coronal view. So where you cut the front part of the body and the back part of the body away. So it's cut like this. That's a coronal view. And we're looking at the inner ear here. So here's the outer ear. Okay, here's your inner ear. So here would be the external auditory meatus, and then the internal auditory meatus. And here's your internal ear. And you'll see this kind of spongy looking bone all around it. That's the petrous portion of the temporal bone. So the petrous portion of the temporal bone houses the inner ear. So here's another kind of CT scan of that same bone. And isn't that cool, the cochlea? Whee! All right, so one more picture for you guys. All right, and we want to talk about the jugular foramen. Okay, it's formed by the petrous portion, which is right here. It's on the internal aspect. The petrous portion of the temporal bone and the occipital bone, which is all back here. It's a really big bone. This is all occipital. Okay, and then this is the jugular foramen there. In there. All right, so the next one is the parietal bone, and it's right back here. So if you put your hands on your head, I just think that they're paired. I have a pair of parietal bones. Okay, and then right behind the parietal bone is the occipital bone. Okay. So this is a superior view here. This is anterior over here and posterior on this side. Okay. So this is one parietal bone and 2 parietal bones. So this would be your left parietal bone, or that's not true. That would be your right parietal bone, and then your left. Okay. You have a pair of parietal bones. And then your occipital bone is the most posterior bone that helps form the cranial skull, okay? And when you guys get to learn about the brain and its function, you'll learn that the occipital portion of the brain is in charge of interpreting sensory information from the eyes, from seeing. So I think of ocular as an eye, and so I remember occipital is in that posterior region where I am kind of synthesizing that visual information. Okay, ocular, eye, occipital, or I have eyes in the back of my head, if your parents ever told you that. It depends on what kind of child you were. So, and on this bone, you have a number of bony landmarks, the occipital condyle. Okay, and these condyles articulate with C1, cervical vertebra 1, okay, which is atlas, remember? And then you have foramen magnum, which is this huge hole here, okay, and your spinal cord travels out of that. And then remember your jugular foramen comes together with the temporal bone, and it's not really shown here, to help form that third bone landmark. All right, so let's go over review. This is a superior aspect of the cranial skull. So the very top is something looking straight down. Here's your nasal bone up here. Then we have your frontal bone. Okay. And you have your parietal bones. Remember, they're paired. You have 2 of them. and then your occipital bone. You can just see the little piece of it. Okay, so now that we're oriented, let's talk about the sutures. Okay, so the first one is the coronal suture, and it separates the frontal and the parietal bone. Okay, and if you know what the coronal plane is, that's separating the anterior and posterior body. Okay, so that coronal suture really separates the anterior cranial skull and posterior cranial skull. So frontal bone and parietal bone. Then you have your sagittal suture, and remember, if we're on the sagittal plane, you're cutting the body into right and left halves. So this sagittal suture separates the parietal bone medially. Okay, and then we have the occipital bone, and between the occipital bone and the parietal bones is the lambdoid suture. And if you look at a lambda, it has kind of that inverted Y, and that's what that lambdoid suture looks like. Okay, so here's actually a portion of the lambdoid suture here. There's the lateral aspect of it. Okay, and here's your coronal suture. All right, so these guys are just review slides for you to practice putting the bones where they need to go. And there's a nice little slide for you guys on cranial skulls. You know, kind of dissected and pulled away. I know we went through it fast, but there's so much to learn in this chapter. So we're going to talk quite a bit about dentition now. So here's your upper dental arches. So those are the ones attached to your maxilla, and then your lower dental arches attached to your mandible, right? Okay. So if you look here, these are your molars. Okay. And adults have 2 bicuspids. And cup means ridge. So molars have 4 ridges. Bi means 2, so bicuspids have 2 ridges. Okay. One cuspid, if we think of it as like our canine, so cuspid just has 1. And then incisors are like scissors. Okay. And that's how to remember. And we have 2 incisors. Well, we have 2 bilaterally. So we have 4 incisors on our lower arches and 4 on our upper arches. Okay, so I want to talk to you a little bit about occlusion and malocclusion. And it's important when you start to look at the articulatory system and you do an oral neck exam to make sure everything is kind of put together really nice in your patient. A class 1 occlusion is when you bite together and your molars and your incisors line up. Basically, the orientation of your mandible and maxilla fit well together. Okay? However, you can have misalignments, and you can have misalignments and their articulation be fine. It's just good to be really aware of it because it can affect articulation, and it can affect chewing and the whole, you know, when you want to get swallowing and everything. So a misalignment of the teeth or incorrect relationship between the teeth and the 2 dental arches. So class 1 is normal orientation of the molars, but the incisors are a little bit off. Okay. Class, and we're going to look at pictures. Class 2 is where the first mandibular molar, okay, are retracted, at least 1 tooth from the maxillary molar. And that's sometimes related to having a small jaw, which is that micronesia. Okay. So carnal part's good. Okay. And then class 3 looks more like this, but it's where the first mandibular molar is advanced at least 1 tooth. Okay. So here's class 1, normal occlusion, normal orientation. Class 2, okay. So molars are oriented just fine. However, abnormal orientation of the incisors. Okay. Then we have class 2. So this is when the molars are not oriented. Class 1, malocclusion means that if it's a class 1 anything, the molars are oriented correctly. But if it's a class 1 occlusion, incisors are oriented correctly. If it's a class 1 malocclusion, mal means bad. If it's a class 1 malocclusion, the molars are on the right track. Both mandibular and maxillary arches, the molars are in the right place. However, the incisors are not. Okay? But when you get to class 2 and class 3, the molars are misplaced as well, at least by 1 tooth forward or back. Okay? So with this class 2, the molars are set back at least 1 tooth, whereas the mandibular molars are set back 1 tooth, okay? And if you have a class 3, which is this guy, the maxillary molar is set back, okay? I had a little Pomeranian Pekingese, and he had a class 3 like this. And sometimes his lips get stuff. So anyway, class 3. You guys might have a dog with one of those. Okay, so here's that underbite, that classic underbite, and we call the class 2 malocclusion an overbite. Okay, so here's just one more picture for you guys. Class 1 occlusion, this is a happy occlusion, everything is doing well. Okay, then we have the class 2 and class 3 malocclusion. That means that their molars are not lined up. And if we have a class 1 malocclusion, molars are lined up, however, incisors are not. Okay, now we get to look at the anatomy of a tooth. So this here is a sagittal view. I don't know if you want to call that sagittal. I don't know what tooth it is. It looks like a custard. Anyway, it's an internal view of an incisor, or a cuspid. Sorry, not an incisor, a cuspid. So first let's look at the most superficial superior aspect, and we'll talk about the enamel. It's one of the most hardest substances in our body. Okay, so here's our enamel. And then deep to that is the dentin. It's a little bit more porous bone, however it's still hard. It's just not as hard as the enamel. Okay. And then medial to that, or internal to that, is this pulp canal. And your nerve endings and your vessels are stored within this pulp canal. Okay? And if we move lateral to our dentin, we're going to find this stuff called cementa. So here it is, they have it listed in pink, travels all the way up. Okay? And cementum is a calcified connective tissue that basically glues the tooth, the dentin, to this periodontal ligament, which is just lateral to it. Okay? And then this pink stuff is your gingiva, your gum. Okay? And this is alveolar bone. So alveolar means little pocket. So you have your alveolar ridge, that's a little pocket for your tooth to fit in. You have alveoli in your lung, there's a little pocket for air. And this alveolar bone is bone that's very porous. Okay, so little pockets in it. All right, so we have, as you guys all know, we have our baby teeth and then we have our adult teeth. Our baby teeth are called our deciduous teeth, and if you think of a deciduous tree who uses its leaves, or who personifies a tree, but you got it. The deciduous teeth do fall out. We also call them milk teeth, shedding teeth, baby teeth. Most of us call baby teeth. And they're shed between 6 and 10 years. However, the interesting part about baby teeth is when they erupt. So you have interosseous eruption. Osseous means bone. So the teeth actually start forming in the bone before the child is born. So interosseous eruption begins prenatally. And then you have clinical eruption. And clinical eruption is when the tooth actually breaks the most superficial layer of the gingiva, when it actually breaks the skin. That's clinical eruption. So that's at 6 to 9 months when the baby is teething. You feel, oh, she's teething. They're in the process of clinical eruption. Okay. And then we move on. Following shedding of the teeth, we move into our adult teeth, which are called our successional teeth, and they start to come in during that shedding period at 6 to 10 years of age. And you actually continue on into adulthood when you get your, early adulthood, when you get your wisdom teeth. All right, so let's talk about the difference between our deciduous and our successional arches. So on the left here is our little baby teeth here. And the main difference is that babies don't have premolars. Okay? And premolars are the same as bicuspids. We have 2 cusps, and adults do. So we have 2 extra teeth on each side of each arch. So you'll see that babies have an incisor, 1 canine, and 2 molars per side of each arch, whereas adults have that additional premolar, and then later in development, 17 to 25 years, you get that third molar. Okay, but babies have 2 molars and adults do until they reach that early adulthood period where they get that wisdom tooth in. Okay. All right, and I just wanted you guys to know that canines and cuspids are the same thing. So you guys can fill yours. You have them on your upper and lower arches. So cuspid, remember, means 1. Peak kind of points on it, and then bicuspid is 2. Okay, bicuspid is premolar. And remember, babies don't have premolars. Babies don't have bicuspid. All right, it looks like that is the end of our presentation today. So I hope you guys enjoyed it. I hope it was a good learning experience for you. And I will keep you posted on when you're going to have your quiz and your test, because it sounds like it was kind of postponed, and it should have been, because I don't think you've had a lot of new information yet. So I'll be sure to keep you posted on the progression of the course. But just for now, focus on this material and get your turns to know the fine. Thank you.